Dr. John Owings here. Welcome to my podcast, Advanced Integrative Health Insider, co-sponsored by Advanced Integrative Health Center, where we integrate chiropractic, neurology, and functional medicine to get to the root cause of a person's illness. Today, we're going to talk about, I want to go over some plantar fasciitis issues. This is a common condition that we see in the clinic frequently, usually at least 3 to 4 times a month. I have patients coming in. Key symptoms: sharp pain in the foot, heel pain. Sometimes the pain eases with activity, but when again, they have constant pain. Really think about causative risk factors: being overweight, overuse symptoms, too much running, not enough downtime, common problems, standing all day, common problems, poor footwear, old shoes, shoes have lost arch support. These all create problems causing plantar fasciitis. Key treatment options, conservative all the way, ice therapy, sometimes put a ball, roll on it. That sometimes helps. My preferred therapy in clinic: laser therapy, scraping techniques to release the muscles and the muscle fibers, get everything to relax. Laser therapy to speed up healing. PMF to help with that. Neuromuscular activation techniques on muscles that aren't firing. We try to do all these therapies on the feet, on the calf, to get the muscles to relax. Usually plantar fasciitis is really caused by these contractions of some of these muscles that either impinge on the nerves, contract the fascia, and you have problems standing and walking. So conservative treatment done early, done quickly, tends to resolve most of these issues fairly quickly, so you don't have chronic lasting pain. So I get questions. I get plantar fasciitis. I probably see at least, I would say 2 to 3 cases of this a month that are coming in. Patients, how does it present? It presents with foot pain when walking. The worst case is usually, the first symptom is usually in the morning when a person tries to stand. They can't stand. So the common question is, hey doc, what's going on? What's happening here? So let's review a little bit about plantar fasciitis. What is it? It's actually an inflammation of the bottom of the foot. This is my foot. We have fascia through here. And of course, there's small intrinsic muscles in the foot and tendons and some ligaments in there. And then you've got the vascular supply, the nerve supply. What happens is the plantar fascia gets contracted, okay? And it can pull, and it's very painful when you try to walk. You can also have bone spurs in the bottom of the heel that can also dig in. That's another form of plantar fasciitis is the bone spurs that they sometimes have to remove. So that's basically what it is that you wake up in the morning, you get contracture of the fascia, you try to walk, you can't, it's painful to walk. Now, what are some of the common causes of this problem? There's a number of things we can look at. One is poor fitting shoes. That's a source of problems for the fascia. Being overweight, weight-bearing issues, so excess body weight over time. Physical exercise where you're damaging the bottom of the feet. So I got runners will sometimes develop plantar fasciitis. Those are common things. Another one is really related to the muscles, the intrinsic muscles of the calf and the lower leg that allow us to plantar flex and extend the foot, rotate. So you got muscles that control all that. So those muscles can become too tight and pull on that fascia. Also, muscles can become inhibited and just not work that well, creating weaknesses in the foot that can also contribute to plantar fasciitis because the body's trying to stabilize the ankle on the feet because the other muscles that control aren't working that well. So there's a lot of factors to consider where plantar fasciitis is coming from. Now, the next thing is the key symptoms that we see consistently. You're going to have sharp stabbing heel pain. Is going to be a primary one, usually with the first steps in the morning. Also, that's its primary symptoms. Sometimes the pain will go away, but it's persistent enough throughout the day that it can create problems. It can be we're going to wander here a little bit because plantar fasciitis can come and go. It can be intense in the morning, lessen throughout the day. Some people show periods where they don't have pain later in the day, but it's every morning they get up, they can't walk. Some people have the plantar fasciitis where they wake up in pain, they can't walk, they stretch it out, it feels better, but it's always hurting. So the key risk factors are going to be overuse, like runners, key standing all day. I have people who are in factory work, they start developing plantar fasciitis, poor fitting shoes contributing to it, tight muscles, tight Achilles tendon, tight intrinsic muscles of the foot. They stop working or they're overworked, they're too tight, they're pulling on it. And then being overweight issues can contribute to the plantar fascia as well. So then the next question that I get, doc, can you help me? How do we fix this? And this is where it can get a little complicated because plantar fasciitis, I always tell patients, you have foot pain, don't wait. Get this stuff looked at right away because the longer it sits there, the more complicated it gets. The primary issue is that in a mild case, the research shows that it can take 2 to 6 weeks to fix. Moderate cases, 2 to 3 months. And then severe cases, I've seen patients fight this. I've seen severe cases, 6 months to a year of trying to fix this stuff. And so it's complicated. Now the question is, from a conservative point of view, what would I do how do I help people to fix the plantar fasciitis? So treatment options in the clinic, the medical model is they can do anti-inflammatories. The medical model can use splinting. You can do home therapy like ice. In the early stages, I would probably say those probably work pretty quick. That's my opinion. Patients come to me that we're seeing is usually it's been pretty severe. Unless they're an established patient, and then we get to work on it right away. Like it starts within a few days. They tell me and we get to fix it. So how, from a chiropractic, neurology, functional medicine side, do we fix this? Step one is we have to get the tendons to start releasing. I don't brace anything. We don't do any of that stuff. So I start with scraping technique where we have stainless steel we call blading. We begin to break the fascia up in the feet. Then we have to move into the muscles. So the first thing is we start scraping and doing tissue work on the calves and the other intrinsic muscles of the calf. After we get that done, we may use shockwave therapy. Shockwave therapy is compressive waves where we're putting that into the feet and we're breaking up adhesions. And we can also do shockwave therapy at the bottom of the foot and up along the calf and the other intrinsic muscles of the leg. So now we've got scraping and shockwave done. The next step is to you're getting blood flow back. So that's where we use PEMF, pulsed electromagnetic field therapy. So we can put that around the leg, around the feet. That's the pulsed electromagnetic field therapy is a pulsing like it generates an electrical field, increases blood flow to an area. My all-time favorite therapy to use that tends to work really good is called TCAR, which is an acronym. It stands for Transfer of Energy, Capacitive and Resistive. This device has two heads on it. One head is a capacitive head, which is a ceramic-like head that uses radio wave frequencies, and it causes the muscles to relax and vasodilates, and it pulls blood flow into it. The resistive head is a stainless steel one that we use around tendons, smaller muscle areas where the tendons attach to bones and stuff like that. So I'll use the resistive head on the bottom of the feet. I'll use the capacitive head on the thicker muscles of the calf. Increasing blood flow allows the muscles to relax, speeds up healing. It's a wonderful technique and patients find it very relaxing. So now we've got scraping on the foot. We've got a shockwave on the foot and calf, scraping on the foot and calf. Now we go into TCAR therapy, which is a form of heat therapy on the calf and the foot. We can get into the next phase, we'd get into laser therapy, which is another type of healing that we can use. We use red light therapy, laser therapy on the bottom of the feet and the calf. That tends to increase blood flow and healing to soft tissue. What we end up doing most of the time is actually stacking all these therapies in a clinical setting, and that helps relax the muscles, generates healing. And then, of course, one of the final things we want to do is make sure the intrinsic muscles of the calf themselves are still functioning and working correctly. So some of the intrinsic muscles that we have to look at, we call the flexor digitorum brevis, the adductor hallucis, quadratus plantae. We've got the gastrocnemius, the soleus, tibialis posterior, flexor hallucis longus, flexor hallucis longus, and flexor digitorum longus. These are all muscles that allow us to bring the foot up and in and rotate. These muscles are all, if this was my calf, these muscles are all located in the calf side, and then they innervate and they go underneath the foot, and they allow us to pull our toes up, bring the foot out, bring the foot in. And these muscles here can get all weakened, they can get tight. You have to make sure they're balanced and working correctly. So we get the muscles working correctly through various activation techniques. If they're too tight, we stretch them, we scrape them, we shockwave them, we laser them for healing, we PMF them for healing. TCAR, transfer of energy, capacity, and resistance, TCAR therapy to get them going right. And that's how, on a conservative level, we start rehabbing the feet. And then, of course, on the functional medicine side, inflammation is a very real problem. Anytime you have something that's hurting, it's also inflamed. So inflammation is real, and it's a kind of a self-propagating thing that can occur in the body. So I also like to make sure the person isn't chronically inflamed. Nutrition does help with that. Things like essential fatty acids, vitamin D level is good. Are they eating well? This all on a downstream matters. It's not the primary thing to work on, but it's important that our bodies not be chronically inflamed. And so there are nutritional things like turmeric, resveratrol, glutathione, essential fatty acids, vitamin D, all are anti-inflammatory of the body. So most of the patients get on some of these protocols. And of course, the biggest source of inflammation that can drive pain is a really poor diet. So diets high in sugar and diets high in gluten, that's pro-inflammatory. Refined foods are all pro-inflammatory. So part of good healing is to minimize the inflammation pathways by getting rid of all the processed foods out, all the gluten, all the sugar, all the dairy. The body really doesn't like it. Getting whole foods in with good clean proteins and a fair amount of good vegetables, intermittent fasting, all decreases inflammation. The nutrition we've talked about, resveratrol, turmeric, glutathione, essential fatty acids, vitamin D are all anti-inflammatory. So now you're quieting the inflammation while you work on restoring normal biomechanical function of the foot. All right. How long did it take to recover? Again, depends on the severity of the case. Hard cases can take up to a year. Mild cases can take a few weeks. My warning is the longer you wait, the more complicated the case always becomes. The faster you get in a problem and address it, you should be addressing it. And from a health and wellness, you should be treating your body like this all the time. You should not ever be, when you have a symptom arise and something's off, ignoring it doesn't actually solve anything. It just means if something's breaking down and you let it sit there, it's just doing more and more damage. And so I'm always encouraging people that, one, you have to understand on a broad scale, our bodies are not designed to be sick. If it was, we wouldn't be a species on this planet. So we would have been extinct a long time ago. So we have very robust, putting religion aside, we have very robust genetics that is designed to deal with the hostile environment. We have an immune system that's adaptive and innate that solves problems. So I'm always encouraging people, if you have a good diet, good lifestyle, intermittent fasting, 2 meals a day, clean foods, day to day, you really shouldn't be getting sick at all. When you do have issues and you have a healthy lifestyle, that might be a clue. We should be, well, what's happening? Well, whatever resource you choose to use, whether it's medical or chiropractors like myself who focus on functional medicine, neurology, the key is to get to asking the questions right away. Like, is this a big problem? Is this a small problem? What labs can we do? How can we begin looking at our body on a wellness level so that we have a health span that tracks to a lifespan and we can maybe live past the average lifespan? Men are about 78, women are about 82. Can we all get to 90 and 100, but have a health span, a lifespan to go with it? Minimizes illness. And then you minimize all these other problems that people have. I just throw that out there as a food for thought. Now, it doesn't mean that shoulder problems don't occur, foot problems don't occur, back problems don't occur, because some of these are really biomechanical insults that we do to our body. If you're a peak performance athlete and you're a young kid playing football, you might have concussion injuries, you might have neck injuries, you might have low back injuries. They might follow you around for a while as you get older. So just be mindful of those. If you're an athlete, you can have shoulder problems, even my runners, my bikers, mountain bikers. You do have problems from crashes and blow up a shoulder, hit a knee, hurt a low back. Repetitive stress strain injuries are real. And so we just have to be mindful of how you want to take care of them. I'm always going to promote a person taking care of their body holistically with, what does that mean? That means exercise every day, but make sure that you're getting adequate rest. Make sure you're getting adequate fuel for the body. So you minimize these stress strain injuries like shoulder problems, like knee problems, like plantar fasciitis. Most of these are overuse injuries. And if we can minimize the overuse, and if you're tired, fatigued, you don't have anything to prove when you keep pushing the body to the limit. I'll tell you, our bodies aren't really trained to be high-end peak performance athletes every day of the week. We actually create overuse problems, create nutritional deficiency problems, and longevity is built on mindfulness. How is my body doing? How does it feel? If it's feeling good, you exercise. But day to day, you eat whole food, you intermittent fasting, you're nurturing your body. You should be able to get 4 to 5 times a week of exercise. That's not hurtful, but it's, 45 minutes. And people ask me so here's a common question when I'm talking to patients, because this is the stuff we go through a lot. Hey, doc, what do you do for exercise? How do you take care of your body? And how do I avoid these problems? So I practice what I preach. I do exercise 4 to 5 times a week. However, from a cardiovascular level, I don't have an exercise routine where I'm 40 minutes cardiovascular nonstop running. Insanity. We're not designed for that. But I do recommend HIIT training, high intensity interval training. And my workout lasts 20 minutes. And it's a stressful one. I strain my body a little bit. So I warm up for a minute and then I start the burst training and I use elliptical trainers to do it. And I might burst for a minute, cool down for 30 seconds. Burst for a minute, cool down for 30 seconds. But that process is done for 20 minutes. After that workout is done, I go to weightlifting. Here's the deal. At 60, I don't bodybuild. I don't try to prove anything. But what I do is I lift almost every day, like 4 to 5 times a week. but I only do 1 to 2 sets of about half a dozen or more exercises, but I change them just about every day. But I'll work out my body every day. Every day I do squats. Every day I do pull-ups. Every day I do push-ups. And sometimes I'll wear a weighted vest to do it. But I'm straining those joints just a little bit because the body loves that sensory feedback, and that creates that stability of those joints as we age. And then, of course, there's intermittent fasting, 2 meals a day. I only eat lunch and dinner. Seldom do I ever eat breakfast. I go to bed at 9. I'm usually up by 4 because I'm studying neurology or functional medicine stuff, see patients. And then starting at 9 on Monday and Wednesday, and Tuesday, Thursday at noon, done at 6. No Friday work. I need adequate rest. I know that doesn't work for everybody in the population, but just things to think about to nurture the body and have the downtime so we don't get these repetitive injuries on the feet, repetitive injuries to the knee and shoulder, or we're getting frozen shoulder, we're getting knee problems, we're getting plantar fasciitis. Because most of these, unless there's direct trauma from a fall, these are repetitive traumas. That's why we want This is why we want conservative care early on. These therapies that we do in this clinic with T-CAR therapy, PMF therapy, laser therapy, the scraping techniques, all of these rehab the muscles that stabilize these feet, because if it doesn't start getting better and you're using, the medical model goes to steroid injections, they have to do all kinds of surgery on the feet. That can get complicated over time. So the faster you work on a problem, the less likely, we hope, that you don't need advanced medical procedures with the surgical things that they do. I'm not saying they're not called for. There are times when you have a heel spur, no amount of therapy I'm going to do is going to take away a heel spur, and sometimes those just have to be surgically repaired. I agree with that. But so just being mindful of how to nurture your body is critical to healing and recovery.